And we're back. This is the World Healthcare Congress coming to you from Washington, D.C. I'm Mabel, Jong, and we're going to get a check-in with a company that has really reimagined healthcare and health insurance through innovation and collaboration. They were here last year. Oscar Health is who I'm talking about. Dr. Alan Warren is here, Chief Technology Officer and Senior VP of Engineering at Oscar Health. Dr. Warren, welcome back.
Thank you, Mabel. It's been great to be back again.
Well, when we first got a chance to speak with you, you had just started with Oscar Health just a little over a year ago. How has it been for you and your company?
It's been a really exciting ride. I mean, the past year has been interesting on all sorts of fronts. From the medical landscape, the health world is undergoing pretty serious changes, and there's a lot of outside noise going on, but internally we're completely focused on building this entire insurance stack and this infrastructure and a digital experience for our members that can really change how they interact with the healthcare world and experience healthcare themselves.
And when Oscar came to market, it was a real disruptor. It looked very different than what other health organizations were looking like. Are you finding that path is still very much the path going forward?
It is absolutely essential to being able to make a difference for those members. The insurance world itself is very complex. Building out all of the machinery and the infrastructure to be a fully operating insurance company, there's a lot of complexity and depth to that. When you take that and add onto it building a digital experience that changes how your members, how consumers interact with that world, that's another level of difficulty. But no one was doing that part. There were other parties that were doing the infrastructure pieces, so the way we started was focusing on that interface with our members, the digital experience, the applications, the sign-up flows, and licensing all of the internals. And over the past 5 years, we've been selectively replacing those internal pieces of our infrastructure so that we can purpose build it all towards operating the way we want to take things forward. But we started at our heart from that digital experience and changing how members interacted with us and with their healthcare experience.
And very recently, you also built a brick and mortar office. So that is different than what you first started out as.
Yes, we're trying to blur the lines between payer and provider without going fully into the provider world and taking on some level of primary care work, whether it's with our telemedicine efforts or with this clinic you're referring to in Brooklyn. We're experimenting with how that works and using it as a test bed for what we can do with doctors' offices to develop the tools that we're giving to our provider partners.
Your approach to members are very different. You're really very much treating them as consumers, really trying to meet them from a retail standpoint. How is that working for you?
It's proven to be sort of the heart of our differentiation, to tell you the truth. When you look at what sets us apart from other insurers out there, if a Cleveland clinic goes and looks at various partners they could have there, the thing that they held up with us was the member engagement. Everyone is talking about it now. We all know that if you want to change consumers' behaviors, you have to have a connection with them and be able to communicate the right paths, the right providers, the right level of care. You don't get that unless you've established a connection with them and trust from the moment when they sign up all the way through to when they need to go to an emergency room. What do? Do they figure it out themselves, or they ask a friend, or do they call us? And so we've focused on that member experience and treating them somewhat as a consumer, but also as a human, and just trying to focus on a trust connection so they know that when they have something going on with their health care, that if they call us, we're going to find the best thing for them, not the cheapest thing for the insurer.
How big is Oscar Health now?
We went from 100,000 members across 4 states last year to 250,000 members this year across 6 states. We added Tennessee and Cleveland with Cleveland Clinic. In Tennessee, we went in with Humana to begin working on a commercial offering, so we're selling to small group now. So we've expanded from the individual market into small group as well. So we cover companies from 2 to 100 lives in the markets that we're
Yes.
who are operating there.
When you partner with a Cleveland Clinic or a Humana, any danger of Oscar Health losing its original identity? When you're partnering with old traditional companies that have been around for a very long time, doing things in a disruptive way, but yet quite traditional as well.
There are enormous challenges with that. It has to do with legal structures and how much their lawyers want to tell you what your interface needs to look like. But on a pure technical front, I don't find that to be a challenge at all. We've got our internal systems, and then there are these touch points and integration points that connect to our providers and to other third parties that we need to work with. Those don't drive how we operate internally. They give us some constraints, but they don't keep us from doing things differently internally. The biggest challenge that I've found when I first came in here, someone wanted to get a hospital system to integrate with us a particular way, and I said, well, we should go and give them an API and do it like this. And they said, oh, they'll never listen to us, we're too small. So there's always that dynamic, and you have to figure out when you are working with these large established players, what's in it for them? What are the incentives behind their drives, and how can you take things in a direction that's going to be better for them as well as enable us to do the new things that we want to.
How are you finding the conference this year?
I'm having a blast. Last year it was very new, but being able to come in, sit on some panels, and see the mix of policy discussions and the perspectives going on. And our panel just now was really fun. We had a great dynamic group, and there was a lot of back and forth. It was really good.
Great, Dr. Warren. Thank you so much. Really
Thanks,
great
Mabel.
to see you again.
Appreciate
Hope
it.
to see you
Good to
next
see
year
you.
and get another check-in.
I hope so. Thank you.
And thank you for joining us. That's it for us today. We're up bright and early tomorrow at 9. See you then.